teaching experience in neonatology, her exemplary contributions have been recognized through numerous awards, including the Outstanding Women Achiever from the Tamil Nadu MGR Medical University in 2012 and the Best Doctor Award from the Government of Tamil Nadu in 2024. Professor Chandramohan has published 14 articles on... Over to you, ma'am.
Sorry to interrupt. My CV will make relevant somewhere else, not here when I have bigger dignitaries on the dais. Good morning to one and all. First of all, let me congratulate the members of Madras School of Social Work and Thunai Trust for coming together. First of all, a big what should I say, namaskaram for coming up with this program which is so close to my heart. I have been working in the neonatology department for more than 20 years, subsequently followed up with development pediatrics. So I know how much a mother's mental health matters. And I'm really happy that you're putting this together. And I'm sure, although they did not show the faculty being doctors, I'm sure they will also be part of this group because we are seeing the effects of poor maternal mental health on our little ones. So we might think that maternal stress is something which is recent. Not so. Now, why would they have a valakapu? Why would a mother be sent to her mother's house in the last 3 months? Only to ensure that her mind is at peace. She can go through the process of delivery without maybe a nagging environment at her in-laws' place or excessive demands till the last very minute. Maybe that may be the reason why she was given a more peaceful environment. So maternal stress is not new. But the stress levels have increased, as we all know. It starts off probably, as he said, from the school age, when a girl has to decide what she has to study. Then after that, when she goes to college, questions start about when is her marriage, when she's married, when is she going to conceive, when she conceives, is it a boy or a girl? And there is no end to the stress that a woman undergoes. And more so, when she is pregnant, there are so many changes in her body, physical, hormonal changes. Even a normal woman would definitely experience depression and anxiety. Forget about those who already have psychotic illnesses. Our main aim should be to support these women. So we do not have we do not have a screening program as such for antenatal women. We do not have anything like that. When they come up with a problem, we then tackle it. I think from now on, we should have a screening program. We should have minimum about 10 questions. I don't know if it is part of the course. Just administer that questionnaire. We do it in pediatrics to find out whether a child has a problem or not, neurological problem. Just 10 simple questions. So some questions like that. And I would always prefer it if it can be done with the husband and the in-laws. Because always a woman's problems, if they are not, very highly manifest, are always poo-pooed. You're always saying this, you're always saying that. They do not realize that it is a very vulnerable period, and they should realize that if a mother's mental health is good, it is going to, enhance that child's life and also the progeny. So why don't you support the mother when she needs it? So I had a personal experience. There was a woman who could not be, she was suddenly missing from the maternity hospital. And when they traced the camera, up to the gate, they knew that she had left the last they saw was the mother standing beside the baby, keeping the clothes and the diaper. And then at the gate, they saw her leaving the hospital. They did not know what happened to her. But the next day, it came out in the paper that this woman had jumped in front of the train. Isn't that the worst thing that can happen to a woman? Suicidal tendencies are very high when the mother is overly depressed. We should not allow another maternal death due to suicide. It is a very big loss. What will happen to the poor child? Who is going to take care of them? If the child has siblings, who is going to take care of that family? Just imagine what that would have driven that mother to such a state. I think we definitely need to support her. And another person who I have seen going through postpartum depression is a staff nurse, a healthcare worker. She couldn't sleep. She just kept. We saw her because her baby was in our postnatal ward. She would just get up every half an hour, and then I don't think she slept for 1 month after the baby was born. She would just get up and say, my baby doesn't have milk. My baby doesn't have milk. Is my baby all right? So that 1 month she was in a very bad shape. Then of course we got some help from the psychiatrist, and now when I see her, I'm so happy because her child is going to college. The support that she got at that time has made all the difference. So I think what the main thing that we have to do is screening, and then we will try to support the women as much as possible, empathize with them, because they should know that they're not going through this all by themselves. Give them as much support as possible. Even in the postnatal ward, we can, if they are always sitting together and chatting, maybe they can play some games or watch some TV or do some little handwork which will take their minds off all the anxieties of having had a preterm baby or a sick baby, because the high stress hormones like the steroids which are produced during the mother's anxiety has an effect on the fetus. It can affect the brain development. It can result in low birth weight or preterm babies. And if we have an increased incidence of autism and ADHD, for which we do not know the cause, we can blame it on this maternal stress. And I think it's high time we all join together and save our moms, give them a good pregnancy, let them enjoy pregnancy and postpartum life, and I think we owe it to them.